is with those at the top economic category, which we know do not understand what is the struggle of ordinary people. So with President-elect Trump, I have no idea what's going on next to me, and I would like to move to the next slide.
I know,
so
people can't see the screen.
People can't see the screen, and we're having trouble on that. I'll tell you what's on the screen while they work on it, so I won't worry about the next slide. Okay, so recently, this past week, at his press conference, President-elect Trump promised that the ACA repeal must be handled simultaneously with replacement, without cuts to Medicaid and Medicare. Now, Speaker Ryan has a different agenda, but that is even moderating. 2 weeks ago, well, not even on the 3rd, January 3rd, when we came back, 10 days ago, when we came back and the 115th Congress started, all the messaging was about how they were going to repeal it immediately and delay the replacement. Because of you all and because of people around our nation, you've changed that conversation. It is huge, and you ought to pat yourselves on the back, but it's only the first step. Now, I know some people feel a little worried because at the Senate and then at the House today, they're voting for what's called instructions. These instructions are to tell the House and Senate committees how they are to proceed, and that is basically strip the economic provisions of the Affordable Care Act out of the budget. We didn't win that vote, but what we did was huge. We changed the conversation. It is no longer acceptable for Congress to repeal without replacing at the same time. And that is thanks to you and folks like you around the country. I mean, I was stunned. Our call-in that many of you were a part of got over 7,000 calls to the Senate on Monday and Tuesday. That was huge, y'all. And every single senator heard from at least 2 of their constituents, which means everybody from California to Wyoming, and from, what's the top, Alaska to, I guess Wyoming's the bottom of that one too. But everybody got calls. That is what's going to make a difference as we move forward. So what we know is last night, Speaker Ryan said on the CNN town hall, oh yeah, they weren't going to do it all just in the first 100 days. They were going to get started on it in the first 100 days. And we've had meetings at Capitol Hill where all of a sudden Republicans are beginning to talk to us about, oh, well, what should we do to improve the Affordable Care Act? Do you have ideas? So this is a big, big change. But what it also says is we have a serious obligation to keep the pressure up. And while we could do this in a sprint, we're going to have to be ready for a marathon, because this is going to be a long haul. And it's going to quickly get into what I call the weeds, the details of replacement. And the details of replacement are going to be much tougher to fight. But this big top-level argument that you can't repeal until you've got a replacement, one is it makes sense for our people who are suffering in the U.S. being terrorized. We had a father call us from Philadelphia who said, he said that he was terrified for he and his wife and his Down syndrome daughter, that they were going to suffer because she would lose her care if they change the form of Medicaid, or they limit Medicaid funding, block grant Medicaid funding to the states. He was weeping because he and his wife had chosen to have this baby as good Catholics and did not choose abortion when they knew she was a Down syndrome kid. And she has been the joy of their lives. But what is he going to do if he cannot provide her with basic care? That is what we're facing. So it's for him and for all the people like him around the country that we've got to stay engaged. So if we can move to the a bit of where we stand and then where we can move. Okay, so we've had the instructions about the Affordable Care Act in what's called a budget resolution. That's what's going on this week. Then they're using a mechanism called reconciliation to repeal only the economic provisions of the Affordable Care Act, the taxes, the funding, those kinds of things, but they can't change the policy. Our ask continues to be really simple, really high level. You don't have to worry about nuance and the weeds of policy. No repeal without replacement. And that replacement must cover as many people and be as affordable as the ACA. And if you want to add a little bit, or as our new president promised, it's going to cover more people and be more affordable. It's the Republican thing to do. And those of you in a Republican district, you can make that argument with a lot of glee. The second thing that we have to really keep our eyes out for, less so in Medicaid, but as the budgets move forward and the policies move forward, less so in budget reconciliation, but is restructuring Medicaid. Because what Paul Ryan wants to do is block grant it so that everybody buys insurance. Well, folks with serious disabilities are never going to get insurance, one, and two, block granting limits the amount of money available in the states. And so for our member in Philadelphia whose daughter needs extensive care, they could be told in July, August, I'm sorry, we're out of Medicaid dollars, you can't have any more health care service. That's wrong in the richest nation on earth. It's wrong economically, and it's wrong from a faith perspective, where we know Pope Francis has said clearly, Pope Benedict said clearly, Pope John Paul II said clearly, health care is a right. And we as people of faith, it's a life issue. We as people of faith know that we're a champion for life. So, and then finally in this, if this all wasn't complicated enough, the Children's Health Initiative program is coming up for renewal. And one of the benefits of the Children's Health Initiative program, CHIP, is that kids get better coverage, additional coverage. Low-income kids get additional coverage, which is really critical, especially in areas of like learning disabilities and some of the other early childhood challenges that kids face. So CHIP is going to be on our agenda. Moving forward, what do we need to do? Well, we need y'all to be active. I'm hoping every time that we give a call for call-ins that we do as well as we've done this week. But make sure there's no repeal without a replacement. Make sure no people lose coverage. Protect programs like Medicaid and CHIP, and lift up a faithful moral vision of health as a human right. And I know some of us have been on various sides of the conversation and the arguments around a pro-life stance, but this is one area where even if you, I mean, I had to do this practice in front of the mirror, making a pro-life argument, do it, because this is the pro-life stance of our time that we must engage. So we need you to step up, talk to your members of Congress, but also talk to your neighbors. Talk to, you know me, I'll advocate my grocery store missionary work and having holy curiosity about getting people's stories. But we've got the call-in days, and if you can see the slide that's up, or go to our website, or if you have a pen and paper there, our house call-in number is 1-888-738-3058. It's 1-888-730-3058. And the Senate call-in number remains the same as the one we used before, 1-888-897-9753. Now these two numbers are going to stay up for the whole healthcare fight, so you can weigh in, but remember your message is simple. Your message is simple, no repeal without an equal replacement. Or better, tell your story. If you've got a story about how the Affordable Care Act benefited you or someone you know and love, tell that story and get your friends involved. this is one time where you can point to, in the last 10 days, we've changed the political conversation in our nation. Thank you very much. Let's keep it up. So thanks for doing it. Now I'll turn it back to Meg.
All right. Well, thank you, Simone. And once again, we will have time for questions at the end. So please make sure you keep sending those in to Kat. Now I'm going to hand it over to Laura Peralta-Schulte, and she's going to talk about access to citizenship.
Thank you, Meg. It is so nice today to speak with everybody on the phone about an issue that I know is near and dear to our hearts, and that is immigration policy and refugee policy. You know, we firmly believe that access to citizenship is going to be a key issue in this new Congress. And as the President said the other day, this is going to require us to lace up our shoes, get a clipboard, and take some action. So in terms of what to expect, let me tell you what we are calling the good, the bad, and the real ugly, at least potentially. We have, thankfully, some offense that we can be engaging in immediately. And that is really offense around protecting people with DACA. We also, the defined
Deferred action
for childhood arrivals. I'm sorry about that. Otherwise known as Dreamers. And there was a bill, a bipartisan bill, that was dropped yesterday, really under the leadership of two senators, Senator Dick Durbin from the great state of Illinois, and Senator Graham, Lindsey Graham from South Carolina. The intent of the bill is really twofold. One, it is to try to chill the Trump administration from removing the protections that President Obama put in place. And the second piece of that is really to push, if possible, this forward as quickly as we can in case President Trump removes those protections. We have a bill. Speaker Ryan yesterday was talking a little bit about immigration as well in his town hall, and was very positive about folks, the DACA kids. And so we are hopeful that with your help we can create some momentum around this and really use this strategically, not only to protect the very protections that we fought hard for the Dreamers, but also to have a chance to go into members and talk not only about the kids, but their parents and other immigrant issues. On defense, you know, this is really a question of a lot of the issues that were raised in the campaign. You know, Trump during the campaign talked a lot about detention and deportation policies. Right now, we still have a number of families, particularly moms and young kids, crossing our southern border at very, very high rates. So that will continue to be an issue. We've heard talk about deportations. There is going to be a need to engage with the Trump administration as it relates to protections for special locations. Churches and schools in particular have always had a special place where ICE has not been allowed to go. So from an administrative standpoint, we have our work cut out for us. Congress as well, we have the Offense of the Bridge Act, but we have threats to sanctuary cities and colleges. We have questions related to money for detention, money for deportations, money for walls. And we really will have a serious discussion this year about what is U.S. responsibility related to refugees at a time when the refugee crisis, as our Pope reminds us, is a worldwide, very serious phenomenon. I think when you step back and look at the lay of the land, the one piece that we would really like to raise with you today is uncertainty, and to be comfortable in living in that uncertainty, because there is a political reality between what candidate Trump said and what President Trump is now messaging about. So there is at least potentially some changes in perspective, particularly as it relates to Dreamers, who, as he has said, merit special attention. You've got, so that is kind of a wait and see action for us. In Congress, it's even more complicated because we know that in the House and in the Senate, there are substantial amounts of members that are really inclined towards comprehensive immigration reform, and you've got other members that are just really anti-immigrant. So there's the conflict there. For things like walls and deportation, thankfully, that all costs money, and we're in a time of very, very tight budgets. So the reality of the funds that would require to build walls, to build more prisons, to take some of the most egregious actions as it relates to deportation versus the reality of the budget really play in our family. Where do we go from here? I love that Simone mentioned storytelling, because all of you, all of us know that immigrants and refugees are full-on members of our community. We need to stand in solidarity with them, and we need to not only know their stories, but tell their stories.
Thanks so much, Laura. So it seems both Simone and Laura gave us lots to think about, and also I'm sure all of us are wondering what we can do. Both Sister Simone and Laura mentioned some things, but I just want to get into a little bit more specifics. So on Network's website, we have something called the Advocacy Toolbox that will allow you to call, well, we'll give you tips and show you how you can call, email, or visit your member of Congress. And the way that you access that is going to our website, networklobby.org. And
I always like that picture of me, my mouth's open.
why don't I see? What are you looking for? I'm looking for the toolbox. The Advocacy Toolbox. And so we have our Advocacy Toolbox that has Educate, Organize, and Lobby. So our Education Toolbox has lots and lots of study guides and discussion guides and things that you can talk about with that are more subject-based, looking at our overall Mend the Gap issues. Our Organize has pieces about how you can get involved with advocates teams or start an advocate team. And then our Lobby is what we're really going to focus on today. So our How to Lobby toolkit. So we have calling our member of Congress, and it has the script and things that you can say. And of course, I'm sure many of you have participated in our call-in day last week, and we are going to have some upcoming call-in days to the House in the next couple of weeks. So we have emailing our member of Congress, and this also is a place where you can sign up for action alerts. I'm sure most of you receive our action alerts, but if you have friends or neighbors who are also interested in doing that, you can do that as well. And then visiting your member of Congress. And I just want to focus on this a little bit because one of our calls to action at the end of this will be focusing specifically on what you can do in district in February. So under our Visiting a Member of Congress webpage, we have directions for meeting in Washington, D.C., but also meeting in district. And all the steps are really laid out here. I'm sure a lot of you have done in-district visits before, but if you haven't, all the steps are here about gathering your group, thinking about who you want in the room with you when you go visit your member of Congress, Especially, I really encourage you to connect with a local social service agency, and also think about bringing in a person who is directly affected by the issue, living the reality of what it would look like if ACA got repealed without a replacement, or what is a DACA student to share their story. Of course, you do have to do some careful prepping, but everyone does. So, and it's a great experience to be in the room and have those people share their stories. So calling the district office, instructions for that, and preparing for the visit. And I just also want to point out, we have this really great lobby visit planning sheet. It is a PDF, so you can print it out, give a copy to every member in your group, and make sure that everyone knows, has background information about your legislator, especially, if they're, think about when they're up for re-election, like how they might be feeling about, are they anxious about that? Are they focusing on the issues? Of course, if they're Catholic and you are Catholic, that's a nice place to start off and share values. But really, anyone of faith, you can have that common language of, we know this is important, coming from a place of faith. Having a list of everyone who's visiting and who's having the roles of who is introducing everyone, who's keeping time, who's making the ask, please make sure, vote no on repealing the ACA without a suitable replacement. Making sure you have the order of who's speaking when. And then, of course, it's kind of a checklist for follow-up. Who's going to write the thank you? What are you going to do next as a group? So our planning sheet will help you with all of that. I also just want to emphasize that network staff, whether it's grassroots mobilization, or we can help you prepare for your lobby visit, we're always happy to talk to your group over the phone. Our government relations team can help you. We'll prepare leave behinds and one-pagers to explain the bill, and we'll keep those up to date for you. Our communications team can also help you with social media and other, interacting with writing letters to the editor or op-eds. So we are all here to support your advocacy efforts, and please don't be shy. Let us know what you want to do, and we can find a way to support your efforts on especially these two issues right now. I hope that a lot of you are already receiving our action alerts via email, but if you want to get them on your cell phone, which I find really easy. Sometimes my email gets buried, but if it's a text immediately on my phone, it gets a little bit more of my attention. You can text Protect Our Care to 877-877. And I'll repeat that one more time, Protect Our Care to 877-877. And once you text that, you'll get a few questions, and just know that the next couple of weeks we're really going to be focusing on the House in terms of the ACA, and so you're going to be getting a series of actions in the upcoming weeks. We don't always text that frequently, but as I'm sure you've heard from Sister Simone, the ACA, things are moving really quickly. We hope to slow it down. We hope maybe you will only get 2 texts instead of 3 in the upcoming weeks. Also,
can I just add one thing, Meg, is that I think in this time we have to think of our calling and visiting and advocacy as creating a relationship for the long haul. And that I know when I was in California and I was a Congressional District 8 contact person back in the old days in Network, and all we had to do was call and say thank you. And I never understood, because we had Congressman Dellums who was fabulous, but I never understood what else to be done. So if you're in a blue state with a good person, developing a relationship with that person to find out what else they need. How can you support their advocacy on the Hill? how can you support them to be a champion and a leader in the House, and who do they talk to on the other side of the aisle? Those kinds of questions can be invaluable, and then share the answers with us here in DC, because we often don't know that. And if you're developing a relationship, that can be the most important thing that we do over the next 2 years to move it forward. But we've got to have interplay between you all doing that work and then let us know what you find out, because we have we're very strong in holy curiosity around here, and we really want to know, because you could be the intel that could make the difference. So I just wanted to add that relationship piece.
Yeah, thanks, Simone. That definitely is true. And what's really great is, if our advocates team or another group of activists do go make a visit, oftentimes our GR team is able to, at least email that member of Congress, if not just drop by the Hill and thank them and chat with them a little bit. And that really, it's that seamless link between you and in your home districts and us up here in DC and on the Hill, letting our members of Congress know that we're here and we care about these issues and we care about them. So it's really important. As I said, in February, right after President's Day, so from February 21st through 24th, both the House and the Senate are on recess. So I cannot urge you enough that if you are able, get a couple of people together, even 2 or 3 people are fine. You can go by yourself, but it helps, I think, to have a team. And make that call to your office and set up that visit. If it's a new member of Congress or someone you've never met before, feel free to bring Network's entire Mend the Gap issues, but make sure that even at this point in February, I'm sure we're still going to be focusing on healthcare, access to healthcare, and immigration. So those would still be our 2 pieces. And again, if you had that visit, our GR team, Laura and Sister Marge, and our associates, Lucas and Laura, will be able to give you talking points and leave behind, since we don't obviously know right now where the Bridge Act or the ACA are going to be by the end of February. So just to recap, Sister Simone gave us a nice overview of what it looks like to be an advocate, to mend the gaps in 2017, and I think we'll continue talking about that contemplative stance in the future and why it's so important for all of us. Then we talked about access to health care and where things are in our battle to save the Affordable Care Act or make sure that they don't repeal it without a suitable replacement that benefits everyone. Laura talked to us about access to citizenship, both defense with the wall and Congress and anti-refugee and anti-sanctuary city stances, but then also the Bridge Act, which was just introduced this past week. I reviewed a few of our advocacy tools and gave you some actions to consider and hopefully take. So now we have some time for questions, and just keep sending them to Kat as we move forward.
Okay, so the first question is, how do we truly prevent the repeal of the ACA without suitable simultaneous replacement when the reconciliation vote seems to already be doing that? What a great question, because the key word in that question is seems. The way the press is reporting it, it's as if that vote actually repealed the financial portions of the ACA. It didn't. And what it did was say to the committees, oh, you need to make a bill that will do that. But here's the good news for us. All of the Republicans who voted for it, both in the House and Senate, can say, oh, they voted to repeal the ACA. But it's only instructions. It's not the actual act of changing it or repealing the ACA. So what our efforts have to do between now and what they've said is January 27th, and the word here in DC is they are never going to make this January 27th date. That was strictly a January 3rd thought. So things have changed in 10 days, and so we have to keep the pressure on repeal and replace, repeal and replace, or repeal and improve. But the important thing is that it be done simultaneously. And already, as I said, people are stepping back from it. So don't get disheartened, think that it's mission accomplished. It's actually good news that the Republicans say, oh, I voted for it, and then not vote for the January, whatever comes out in January 27th. And there have already been, I believe it's 7 or 9 senators that have Republican senators that have raised this concern. So that's our best line of defense. So keep the pressure on. The second ACA question says, how do we prevent the ACA from simply death spiraling to oblivion through results of a reconciliation vote? Well, this death spiral to oblivion, that is what the insurance companies are arguing, because they don't want repeal and delay either. And so this, as long as you hear about death spirals and, you know, horror stories from the insurance company, that's great. The more they put pressure on, then we're united. Senator Kennedy used to tell us, in legislation, you don't have any permanent enemies and you don't have any permanent friends. And it's not often we're on the same side as the insurance companies, but in this one, we actually are. So the good news is that we can, that they talk about death spiral, great, let them do it, as long as they haven't come up with the answer to it. Now the other piece, though, that should be our talking point is really about not the death spiral of the insurance companies, it's the death spiral of our people and what it'll mean for them. And many of you know that I've talked about Margaret Kistler, who died because she didn't, at 56, because she didn't have health care, that she lost her health care in the recession. She died in 2012 before the Affordable Care Act was fully implemented. There are tons of stories all around you. So use those, use your story, use other people's stories, because while the insurance company is, you know, some are going to worry about because of the economy, we worry about our people, and telling the stories makes the difference. So it's good news if we're hearing about death spirals, because it's going to slow it down. Okay, so we've got couple of questions here. One is, okay, we just got a question I'm indicating to my staff, my colleagues here. We're going to do at the end because it's a great question. So the, what is the major issue to focus on in the Senate and the House? It's these two. Both places we've got to focus on the Affordable Care Act. We've got to focus on the Bridge Act. It is the opportunity, the doorway, the gateway, the chance to make a difference for our people. And they're going to, down in another couple of weeks, there are going to be some additional things like tax policies revving up, so we're going to have something on that. The census, getting the census fully funded is critical for any of our issues, but those are down the road. Right now, the next month or two, these two, the Affordable Care Act and immigration, are at the heart of our work. Oh, somebody's saying, what's the Bridge Act? Good question. I'm sorry. I got after Laura for saying DACA, and I didn't even tell you what the Bridge Act was. The Bridge Act is was what Laura was talking about. Do you want to explain it a little bit more?
So as you will recall, the administration, you will recall that the administration was able to move forward and protect young people who, and this is just the rhetoric that they use, were brought to the United States for no, quote, fault of their own, and have lived here and gone to our schools and in our workplaces. So Mr. President Obama provided protection from deportation for these young folks. That was done by executive order. That was not for lack of trying, as we all remember with comprehensive immigration reform. But it is those protections that the Bridge Act tries to maintain, so that those folks who currently have DACA would not be subject to deportation. A very important feature of that bill is also related to their information. The government has all of the important information of these dreamers because they've had to apply for this special program. So it really is critical that they not be subject to deportation and that there be no funny playing with their information. There was a related question on the issue of who are the key players on immigration. The Bridge Act, this protection for DACA young people, that is, again, Senator Dick Durbin, who is from Illinois, a Democrat, and is in leadership in the Senate. On the Democratic side, you've got Mr. Schumer, and really all of the Democrats in support. The Republican that's leading on the Senate side is Lindsey Graham from South Carolina. We are slowly building a good, robust list of Republicans, even some unlikely folks, because there is great sympathy for students who have been through our schools and are working. So on the House side, it's again Representative Gutierrez, also from Illinois. You've got a new person taking leadership on the Republican side, and that is Mike Kaufman, a Republican from Colorado. So we do believe that this has legs, that we can move it forward. We know that a majority of Republicans support some level of reform. And the question that they really have to face is, how do they stand up to the minority in their party that are anti-reform?
And then the question also is, who are the key players in the Affordable Care Act? We believe the Senate is the absolute key to this, to making sure that it's not repeal and delay, that it's repeal and replace. The keys are the Murkowski from Alaska, and then you get the two senators from Arizona, McCain and Flake. You get Portman in Ohio, Toomey in Pennsylvania, Collins in Maine, Lamar Alexander, and I know he's Tennessee, but I just blacked on the other guy. The other guy from Tennessee, Corker from Tennessee, and I'm leaving two out.
Capito.
Oh, Capito from West Virginia. Any of the states that have expanded Medicaid and have Republican senators and or governors. We believe that getting the governor, a Republican governor, to talk to their senators is key, because, I mean, for once, we're all united in this, and the states and our people would suffer. So those are the keys. Now, as I said before, if you don't have one of those, if you're, I used to be, as a blue person in a blue state, I never had anybody to talk to. But what you do is you call your senators and encourage them to speak then to the Republicans, and encourage them to cross the aisle and be champions for this repeal and replace. Okay? Yeah.
Just one thing is, we have been up this week on the House side, and it's really a mirror image that the Republicans that we've spoken to in Medicaid expanded states sound a lot like their counterparts in the Senate. They know that their people have health care, and they are nervous. So knowing that it is the House that is going to be taking the first stab at rewriting the bill, make sure that you're talking to your individual member of Congress, particularly if your state has expanded Medicaid or you live in a district that Hillary Clinton won in 2016.
Good point, Laura. Well, we have one last question. We're coming to the end of our time, and then Meg will do a little wrap-up after I finish. But I really want to answer this question because we've struggled with it here. And this question is, how can I remain hopeful given the divisive nature of the new administration? And I want to go back to what I said at the beginning. The fact is, these are tough times. These are hard times. This is not what we hoped for. This isn't what we saw as the way forward for our nation. But this is the time that we're built for. And hope is a communal virtue. The only way we can have hope is if we are connected with each other. That is what's going to see us through. And that connection with each other has got to be grounded, I believe, in that shared listening to what I call the wee small voice, or the Holy Spirit, on the inside that will lead us forward. I know we will not be left orphaned. I know that we will be given the words that we need, the actions that we need. And I often think of that experience I had of soon after the bus. And I had known that where we were at that time, the first bus trip, that my image was from retreat in 2011 that when you put radical acceptance and fighting for a vision together, you get fire. But in the bus experience, I realized not only was it fire, but we were all being called to be a burning bush, to let God flame up in our lives and to let people find their way forward because of the light of our commitment to those who are at the margins. Then I was seeing Paul Ryan. I'll never forget this. I took my scripture along because I had all my pictures and people in the scripture that my Bible that I wanted to share with him. And I was rereading the story of Exodus, and and God saying that God has come. That's why God's in the burning bush. It's because I've heard the cry of my people. And so I thought, oh, that's lovely. But for the first time, I don't know where I was, but before that, but for the first time I turned the page, and what it said was, so now I'm sending you to Pharaoh. And my response was just like Moses, who am I to go to Pharaoh? What a doofus idea that is. Well, I think our time is just like that, because we know the commitment of our faith, because we know what's needed, because we know the struggles of our people. There's consequences. If we radically accept the commitment to love and fight for a vision, that's fire. And then we are sent to Pharaoh. So I hate to tell you, Pharaoh may be a very challenging person to engage, but that's where we're called. That's the best of who we are. So let us maintain our connections with each other, because that is where hope is, that's where change is, and that's where we can be faithful. Listening to the wee small voice, even though I'd rather say, I'll stay home, I'm not going to go visit Pharaoh. Together we can do this. Yeah, we can do it. And I'm certain that's why we were born for these times.
All right. Well, thank you to Sister Simone and to Laura. I'd also like to thank my fellow team members, Kat, for writing down your questions to us. And then also to Emma, who's out there running tech and trying to help answer all of your questions if you were having a hard time connecting today. Especially if you were calling in and didn't have the opportunity to type up your your questions, please feel free to email me, Meg Olson at Molson, MOLSON, at networklobby.org. And I will make sure it gets to the appropriate person. And again, if you are planning on doing an in-district visit, please contact me, and I'll pull in who needs to come to the table and help you prepare for your visit so that you're successful and feel good about it. Even if you are going to see Pharaoh, there are ways that you can measure success.
Oh, I just want to say, if you get a meeting with Pharaoh, that is success.
Yes, absolutely. Yes, and so we'll be doing these webinars about once a month. So keep an eye out for our next invitation. And thank you all for your patience today with our technical issues that we were having. I promise you yesterday everything worked fine. So that's often the story. So thank you so much, and we will be in contact with you soon. All right, thank you.